Welcome to another deep dive into a fascinating case from vet neurology.
Oh, yeah.
We're looking at a 2024 article from Veterinary Radiology and Ultrasound.
Uh-huh.
It's all about an 8-year-old dog diagnosed with a pretty rare spinal cord condition.
Right.
Inflammatory pseudotumor.
Or IPT, for short.
Exactly, IPT.
Yep.
So we're going to do a deep dive into this case study.
Okay.
Explain it all at a doctor level.
Sounds good.
So
Let's get into it.
this case is really interesting because initially
Yeah.
it was misdiagnosed,
Uh-huh.
which
Yeah.
it happens a lot with IPT.
Yeah, they can be tough.
Yeah.
Based on the imaging, it looked like a neoplastic lesion.
Oh, so like a tumor.
Like a tumor, yeah.
Okay.
But as we go through this,
You
we'll
did.
see that it was something else entirely.
Okay, so let's start with
Okay.
how this dog presented.
Okay.
This 8-year-old mixed breed
Yep.
had a 1-month history of cervical hyperesthesia
Oh, wow.
and difficulty walking. Initially, they were treated with prednisolone,
Uh-huh.
and it provided some relief.
Okay.
But then
Oh.
the symptoms came back when they tapered the medication.
Oh, interesting. Okay.
Yeah, and that initial response to steroids,
Yeah.
that's something that we're going to come back to later.
Okay.
So
Okay.
during the neurological exam,
Yep.
this dog had a bunch of different symptoms.
Okay.
So they had
Yeah.
low head carriage,
Uh-huh.
they had a hunched back,
Okay.
which is also called a kyphotic posture,
Right.
weakness in all 4 limbs,
Oh, wow.
tetraparesis,
Yep.
and then they also had a mild proprioceptive ataxia,
Okay.
which means that they're having trouble sensing where their limbs are in space.
Gotcha.
And then, importantly, that cervical hyperesthesia,
Yes.
the sensitivity in the neck,
Right.
that persisted.
Uh-huh.
And then also the blood and urine work
Yeah.
were unremarkable.
Interesting.
Yeah,
So it's like, okay, what's going on? You've got some pretty significant neurological signs,
exactly.
but nothing showing up
Right.
systemically.
Exactly. So the next step was advanced imaging.
Okay.
They did a 3 Tesla MRI of the cervical region,
Right.
and they found a mass at the C1, C2 level.
Okay.
And figure 1 in the article
Uh-huh.
really details these MRI findings.
Okay.
So the mass appeared isointense to the gray matter,
Okay.
but it had a darker
Hmm.
hypointense ventral core on T2-weighted and SDR images.
Okay.
And then it was also isointense on T1-weighted images.
Gotcha.
And then after they injected the contrast agent,
Yeah.
it showed this strong and homogeneous enhancement.
Uh-huh.
But the MRI also showed something else that was really important.
Okay.
The spinal cord
Yeah.
from C1 to C5
Uh-huh.
appeared hyperintense
Okay.
on T2-weighted and STR images.
Gotcha.
And that suggested that there was edema
Right.
around the lesion
Makes sense.
and possibly syringomyelia,
Oh, wow.
which is that fluid-filled cavity
Yeah.
within the spinal cord.
Okay.
So all these findings
Uh-huh.
really pointed towards a neoplastic lesion.
Right.
So the top differentials were meningioma,
Uh-huh.
lymphoma,
Uh-huh.
histiocytic sarcoma,
Yeah.
or a hemangiosarcoma.
Gotcha.
And an inflammatory lesion was considered less likely,
Hmm.
just because of how solid the mass appeared.
Okay.
So this is kind of where the misdiagnosis comes in,
Right.
which, as we said, is
Yeah.
common with IPT.
They can be tricky.
Yeah.
For sure.
So with the potential tumor on the table, a surgery was the next step.
Okay.
So they did a C1, C2 partial dorsal laminectomy,
All right.
androtomy,
Uh-huh.
and they were able to remove the mass
Right.
all in one piece or en
Yeah,
bloc.
block. Yeah.
And macroscopically, the mass had some interesting features.
Yeah.
And you can see this in figure 2 of the article.
Okay.
It was multinodular,
Uh-huh.
solid,
Yeah.
beige-brown in color,
Okay.
with rounded margins,
Mm-hmm.
and a really coarse, granulated surface.
Interesting.
So not quite the typical presentation
All right.
for those conditions that they were suspecting.
Yeah. So already it's like,
Exactly.
this is a little weird.
Something a little different here.
Atypical. Yeah.
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 So after surgery, this dog was put on a bunch of different medications.
Okay.
So they were on ampicillin,
Uh-huh.
prednisolone,
Okay.
meropetant,
Yep.
gabapentin,
Uh-huh.
and methadone,
Okay.
which was later replaced with tramadol.
All right.
And they also had physiotherapy
Okay.
as part of their treatment plan.
Makes sense.
But this is where the story takes another turn.
Okay.
So despite the surgery
Uh-huh.
and all of this post-operative care,
Yeah.
the dog actually showed initial neurological worsening.
Oh, no.
Yeah.
So they regressed.
Yeah. And so while there was some improvement
Okay.
in the following months,
Uh-huh.
because of how severe these clinical signs were,
Yeah.
and just the challenges with the supportive care.
Right.
The owner actually ended up choosing euthanasia.
Oh, that's so sad.
Yeah, about 3 months later.
Wow.
So a really heartbreaking outcome.
Yeah, definitely.
But as you mentioned, the case doesn't end there.
Right.
This is where the histopathology,
Yes.
the microscopic examination of the mass, becomes crucial.
Okay.
Because it reveals the true nature
Right.
of this condition.
Of what this actually was.
Exactly.
Yeah.
So remember how they initially thought it was a tumor?
Right, based on the imaging?
Well, the histopathology completely threw that out the window.
Oh, wow. Okay.
Yeah. And figure 3 in the article illustrates these findings.
Okay.
Beautifully.
Right.
So instead of finding tumor cells, they found a proliferation of large spindle cells.
Spindle cells, huh?
Yeah, and a fibrovascular stroma.
Okay.
So
not what you would expect.
Not at all.
With a tumor.
Yeah. Can you talk a little more about spindle cells?
Yeah, so spindle cells are these elongated cells.
And you can find them in all sorts of different tissue.
Okay.
And they can be associated with both normal and abnormal growth.
Okay. So what was really striking in this case, though, was that there was this significant inflammatory infiltrate alongside these spindle cells.
Okay.
So there were tons of inflammatory cells, plasma cells, neutrophils, lymphocyte aggregates.
Wow.
All mixed in.
So like a huge immune response?
Yeah. Picture the immune system just going into overdrive in this one specific spot.
Wow.
Yeah.
Okay.
So we've got this mass with these spindle cells and all this inflammation.
Yeah.
So how does that lead to a diagnosis
Good question.
of inflammatory pseudotumor?
Yeah. How do we get there?
Yeah.
Well, there were a few key things that pointed to IPT. First, the spindle cells.
Yeah.
They weren't arranged randomly. They were actually organized in streams, bundles, and whorls.
Oh, and then they did immunohistochemistry, which helps us identify specific proteins in the cells.
Yep.
And it showed that these spindle cells were expressing markers like IBA1, MHC2, and CD18.
Okay.
And those markers are usually associated with histiocytes,
Okay.
which are immune cells
Right.
that are involved in inflammatory responses.
So it's all pointing towards this inflammation.
Yeah, it's all about the inflammation.
Yeah.
So the cellular makeup
Yeah.
and the immunohistochemistry findings really pointed towards inflammation
Okay.
rather than a tumor.
So not cancer.
Not cancer. And they didn't find any evidence of any infection
Wow.
or any other known causes
Right.
for this type of inflammation.
Okay.
So the final diagnosis was inflammatory pseudotumor.
Inflammatory pseudotumor.
IPT.
IPT.
Yes.
Now, IPTs,
Yeah.
especially in the spinal cord,
Well,
are pretty rare.
they are super rare.
Aren't they?
Especially in the spinal cord.
Can you talk a little bit more about these pseudotumors and the challenges that they present?
So, yeah, you're right. Spinal IPTs are incredibly rare in dogs. Like, we're talking only a handful of reported cases.
Wow.
And that rarity is part of the problem.
Oh, how so?
We still don't really know what causes them.
Really?
Yeah.
So what do we know about IPTs?
We know that there are these mass-forming lesions characterized by this proliferation of spindle cells and this heavy inflammatory infiltrate.
Right.
But their origin, their pathogenesis, is still a huge mystery.
A mystery wrapped in an enigma.
Exactly.
You could say.
Yeah.
So there are some theories out there.
There are.
Right.
One thought is that maybe IPTs are triggered by an exaggerated immune response to something.
Okay.
So maybe an infection, trauma, a foreign body. But in this case, they didn't find any evidence for any of those triggers.
So it really is a diagnostic puzzle.
A real head scratcher.
Yeah.
For sure.
And then there's another layer of complexity here.
Oh, what's that?
There's actually this debate about whether IPTs are truly inflammatory or if they represent some kind of low-grade neoplastic process.
Oh, wow.
Yeah.
Interesting.
So this debate comes from the fact that most IPTs are actually benign.
Right.
And they respond well to surgical removal. But there have been cases of recurrence.
Right.
And even metastasis.
Oh, wow.
Both in humans and animals.
So even though they're called pseudotumors, they can act like a tumor.
They could behave like a tumor.
Yeah, exactly.
So it adds another layer of uncertainty.
Yeah, for sure.
When it comes to prognosis and long-term management.
Absolutely.
And that's actually what we'll explore in the next part
of our deep dive.
Looking forward to it. Yeah, me too.
Yeah.
So we've established that inflammatory pseudotumors, or IPTs, can be really tough to diagnose.
Yeah, for sure.
Especially in this case where they initially thought it was a tumor.
Right, thought it was cancer.
And then histopathology showed the truth.
Revealed the real culprit.
So for vets who are dealing with similar cases, what's the key takeaway here?
I think the biggest thing is that we can't rely solely on imaging.
Okay.
Like advanced imaging techniques like MRI.
Right.
They're super helpful.
Yeah.
But they don't always give us the whole picture.
Yeah, I see.
Histopathology.
Yeah.
Looking at the tissue under a microscope.
Right.
That's the gold standard
for
reaching a definitive diagnosis.
Got it.
Especially for conditions like IPT that can mimic other things.
So if a vet suspects an IPT, what are they actually looking for?
Okay.
Under the microscope.
Yeah, we're looking at the cells, their arrangement, and then we use immunohistochemistry.
Which helps us identify specific proteins within those cells.
So for IPTs, what specific markers are we looking for?
We're looking for markers that line up with the types of cells that are involved. So for instance, lymphocytes, they'll usually express CD3 or CD20.
Okay.
And then plasma cells will stain positive for CD79A.
Got it.
Spindle cells.
Yeah.
They often express vimentin, which is a protein found in cells of mesenchymal origin.
And so they might also stain positive for smooth muscle actin, which indicates myofibroblastic differentiation.
Exactly.
So it's like piecing together a puzzle.
It really is.
You're looking for these telltale signs.
Yep, looking for those clues.
That point to IPT.
That point to IPT.
So by carefully examining those cells, their arrangement, and then their immunohistochemical profile, a vet can really differentiate IPT from other conditions.
Absolutely. It's a meticulous process.
But it's crucial for getting the diagnosis right.
And ultimately for deciding the best way to treat it.
Exactly. Treatment all comes down to that diagnosis.
Now, we've talked about surgical removal being the preferred treatment.
Yeah.
For IPTs.
Usually the best option.
But are there times when surgery isn't a good option?
Yeah, for sure.
Okay.
So if the IPT is in a really delicate area of the spine, or it's really hard to reach, then the risks of surgery might outweigh the benefits.
I see.
It's a tough decision.
Yeah.
You have to consider a bunch of things. Like the location.
Okay.
The size of the IPT. How bad the neurological deficits are.
Right.
The overall health of the dog.
Okay.
And of course the owner's wishes.
Right. And their resources.
And their resources, of course.
So it's really a team effort.
It is.
Between the vet and the owner.
Yep.
Working together, weighing those pros and cons of surgery.
Yep. Got to make the best decision for the patient.
So if surgery isn't an option, what else can we do?
Well, corticosteroids can be used to help manage the inflammation.
Okay.
And hopefully shrink that mass.
Right.
But their effectiveness can really vary.
So are there any other medical therapies that people are looking at for IPTs?
Yeah, there's some interest in using NSAIDs, non-steroidal anti-inflammatory drugs, to manage IPTs.
Gotcha.
They work by inhibiting prostaglandins, which are involved in the inflammatory process.
Okay.
But we need more research to be sure how well they actually work.
Got it. So more to come on that.
Exactly. Stay tuned.
So let's talk about prognosis.
Okay.
So what can an owner expect?
Yeah, that's the big question.
If their dog is diagnosed with a spinal IPT.
And unfortunately, there's no easy answer.
Okay.
The prognosis for spinal IPTs, it can be all over the place.
So it depends.
It depends on a lot of things. Well, location is a big one. Lesions in the cervical spine, like the case we're discussing, they tend to have a worse prognosis.
Because
they can compress important structures.
Oh, okay.
Like the spinal cord and the brainstem.
So the higher up the spine.
Yeah.
The worse the prognosis.
Pretty much.
Okay.
The size of the mass also matters.
Okay.
Bigger IPTs, they're more likely to cause compression. And more severe neurological problems.
Makes sense.
And of course, how bad the symptoms are initially. That plays a big role too.
So it sounds like it's really complicated.
It is.
To figure out the prognosis.
It's not a simple answer.
For spinal IPT.
You have to look at the whole picture.
So open communication.
Yes.
Between the vet and the owner.
So important.
Is key.
Got to talk about the potential risks and benefits of treatment. What the expected outcome might be. And the possibility of needing long-term care.
And speaking of long-term care, what kind of support might a dog with a spinal IPT need?
Well, it really depends on the dog and how bad their condition is.
Right.
Some dogs, they might recover completely and not need much care at all.
Wow, that's great.
Yeah.
But others might need lifelong management.
It's tough.
Yeah. So can you give some examples?
Sure.
Of the kind of support these dogs might need?
Physiotherapy is usually a big part of long-term care.
Right.
It can help improve their mobility, strength, and coordination.
Got it.
And some dogs might benefit from hydrotherapy too.
Hydrotherapy.
Yeah, using the buoyancy of water to support their weight.
Makes sense.
And help them move better.
So pain management is also really important.
Oh, absolutely.
Because IPTs can be painful.
Yeah, they can cause a lot of discomfort.
Especially if they're pressing on nerves.
Right. Or causing inflammation.
So what are our options for managing pain?
We have a few different medications. We can use NSAIDs, gabapentinoids, and even opioids in some cases. Acupuncture and other complementary therapies can also provide relief.
So it's all about finding the right approach.
It is.
For that individual dog.
Individualized medicine.
Finding that right combo.
Yeah, finding what works.
Of therapies to manage their pain.
Tailoring it to their needs.
Now for our listeners who might be worried that their dog could have a spinal IPT.
It's a scary thought.
Yeah. What are some early signs?
Okay, so the most common signs usually have to do with pain in the neck or back. So you might notice your dog being hesitant to move their head or neck. Maybe yelping when you touch them there.
Oh, yeah.
Or having trouble jumping.
Got it.
Or climbing stairs.
What about some more subtle signs?
Yeah, sometimes the early signs can be really subtle. So you might notice your dog is less excited about playing or going for walks.
Right.
Maybe they seem stiff or sore after resting.
Gotcha.
Any changes in their normal behavior or how active they are, that's something to pay attention to.
So really being aware of any changes.
Exactly. Even small ones.
Yeah.
In their dog's behavior.
That's important.
It's crucial.
And if you notice anything unusual, it's always best to check with your vet.
Absolutely. Better safe than sorry.
Early detection and intervention
that's so important.
Are key for better outcomes.
They can make a world of difference.
Well, this has been a really fascinating look.
It has.
At inflammatory pseudotumors.
Yeah.
We've talked about the diagnostic challenges, the nuances of treatment, the ongoing debate about their nature.
But they really are.
Yeah, and the promising research.
The future is bright.
That lies ahead.
Hopefully lots more to learn.
It's clear that we're constantly learning and discovering.
Pushing the boundaries.
To provide the best care for our animals.
That's what it's all about.
So it's been a pleasure delving into this topic with you.
It's been a great discussion.
And the journey of understanding and treating ITTs continues.
It definitely does.
We've learned so much about inflammatory pseudotumors.
Yeah, it's been a great overview.
From the difficulties of diagnosing them to the complexities of treatment and prognosis.
Oh, absolutely.
So let's turn our attention to the research.
Okay.
What are scientists finding out about these IPTs?
Well, one area that's really hot right now is genetics.
Genetics.
Yeah, scientists are trying to figure out if there's any genetic mutations or variations that might make some individuals more prone to getting these pseudotumors.
So there's a chance that IPTs could be linked to genetics.
Yeah, it's looking more and more likely.
Wow.
There have been a few studies that have identified some potential candidate genes, but we need more research to confirm those findings and really figure out how it all works.
Because if we could pinpoint the genetics behind IPTs, that could lead to
it would be huge.
New ways to diagnose them.
Absolutely.
And maybe even treat them.
That's the hope.
Imagine being able to screen for these genetic markers and identify dogs who are at higher risk.
Early on.
Yeah.
Way before they even show symptoms.
And then we could monitor them more closely.
Right.
Intervene sooner.
Exactly.
And hopefully improve their outcomes.
That would be a game changer.
It really would be.
For sure.
So are there any other exciting research avenues out there?
Yeah, there's a lot of buzz about developing new targeted therapies.
Targeted therapies.
Yep. Researchers are looking for drugs that zero in on the specific inflammatory pathways that are involved in IPTs.
So instead of using those broad-spectrum immunosuppressants,
Right, like corticosteroids.
which can have a lot of side effects, we could have more precise tools
Yeah, that's the goal.
to control the immune response.
And hopefully minimize those side effects.
So these targeted therapies could potentially be more effective
Yeah.
and have fewer side effects.
That's the hope.
Can you give us some examples of these therapies?
Sure, one example
Okay.
is Janus kinase inhibitors,
Okay.
or JAK inhibitors.
JAK inhibitors.
Yeah, they block the activity of certain enzymes that are part of the inflammatory signaling pathways.
Gotcha.
And they've shown some promise
Okay.
in treating other inflammatory diseases.
So they're hoping that they might also work for IPTs.
Exactly. It's still early days.
Are there any clinical trials going on right now?
There are a few early-stage trials in humans
Okay.
looking at JAK inhibitors and some other targeted therapies for IPTs.
Got it.
It's too soon to say, for sure.
Yeah.
But the initial results are looking good.
So we'll keep our fingers crossed.
Fingers crossed for sure.
Now, I want to go back to something you mentioned earlier. That debate about whether IPTs are really inflammatory
Right.
or if they're actually a low-grade neoplastic process.
Yeah, that's a tough one.
It is a tough one.
The line between inflammation and neoplasia can get really blurry.
Yeah, especially with IPTs.
Especially with IPTs, yeah.
So what's the current thinking?
Well, most people think that IPTs are probably a spectrum.
Okay.
So some might be mostly inflammatory, while others might act more like a neoplasm.
So it's not a clear-cut yes or no?
Nope. It's complicated.
It really is.
And that makes it even harder to figure out the diagnosis and treatment.
So we need to figure out where on that spectrum a particular IPT falls.
To make the right decisions.
Are there any new diagnostic tools out there that might help us with this?
Well, there's a lot of interest in using PT scans.
PT scans.
Positron emission tomography to get a better look at these lesions. PET scans can tell us about the metabolic activity of tissues, which could help us differentiate between inflammatory and neoplastic processes.
So PET scans could give us a more detailed view.
That's the idea.
Of what's happening inside those pseudotumors.
And help us predict their behavior.
So we could identify the more aggressive IPTs versus the benign ones.
Exactly.
That would be incredible.
It would be a huge step forward.
It really would.
Sure.
So it all comes back to research.
It does.
And innovation.
We're always learning.
In this field.
Nowhere to come.
This has been such an interesting deep dive.
It has been fascinating.
Into inflammatory pseudotumors.
Yeah, we've covered a lot.
We've explored the diagnostic challenges, the ins and outs of treatment.
Right.
That debate about their true nature.
Yeah, the mystery continues.
And all the exciting research happening right now.
The future is bright.
It's so clear that we're always learning.
We are.
And discovering.
Always pushing the boundaries.
To give our animals the best possible care.
That's the goal.
Well, it's been a pleasure talking about this with you.
The pleasure was all mine.
And remember, from Vet Neuro Jar, keep those minds-inspired hearts light and tails wagging.